Okay, so I guess I'll get started. Um, Good afternoon, everyone. I'm Dr. Anson Moyse, and I have the opportunity to present something that I'm pretty passionate about in terms of improving access to quality healthcare to our patients in the city, in the rural communities, and to the world at large. Over the past 6 months, I've partnered with a healthcare tech startup called Soma Health, who are pioneering really advanced technology in regard to remote patient monitoring. Their mantra essentially is they provide a digital health ecosystem that simplifies the patient-provider relationship. Specifically, this company is able to customize different programs that can improve what levels of access our patients can have. For example, I'm an anesthesiologist, but I subspecialize in pain management. So my focus of my practice with respect to my patients is with respect to musculoskeletal care. So the biggest barriers that I have with my patients is them not being able to make their appointments. Even though I'm in the city, and you would think access to seeing me in the office is easy, but when you have the logistical difficulty of having extremes and chronic pain, patients aren't able to make it to their office visits. So that's how it works for me. But it can be customized to any specialty and any patient population. For example, there's a huge benefit in the primary care space where, let's say in a rural community, a doctor's several miles or hundreds of miles away from their patients. They're able to monitor their vital signs and their conditions in between office visits. And also, if the patients are unable to make it to their office visits, they can have a telemedicine visit as well, all through the Soma Health platform. There are three main products within Soma. Remote patient monitoring, which is essentially the patients are sent home with a device that allows them to check their vital signs, their heart rate, their blood pressure, their pulse oximetry levels, finger stick data. And once they're able to put these information into their phones or through the devices, it gets sent immediately into the database and the portal of the healthcare provider. The other item that they have is Soma Pulse, which is a wearable device, kind of like your Fitbits, but it takes it a little bit further with respect to EKG monitoring, finger sticks, and other levels of vital information. And probably what I'm most passionate about with respect to my space is the remote therapeutic monitoring, because what that does is for patients, for example, my patients who are dealing with chronic pain and physical therapy and rehabilitation, they're able to get programs sent to their phones that they can do in real time with a therapist who could be hundreds of miles away. And they're able to also measure their ranges of motion and measure their progress as they go through the therapies daily. So what I did with my patients between October of last year and January of this year, I had about 64 patients that I set up in the pilot program. I had them come to the office. I described Soma to them. I enrolled them. I had them I explained to them how they would input the data and made sure that they understood how the system worked. With the assistance of the Soma representatives, they were able to figure out how to easily put this information in. And I asked them every day to record their vitals, their blood pressure, their heart rate, their pulse oximetry levels. But in addition to asking for them to collect that data, I was asking them to also input into the system what they were feeling that day. What was their pain score at the time where when they took that, recorded that blood pressure? What were they feeling? Were they feeling radiating pain down their leg? What was going on at the time? So I'd ask them to record it twice. I want recording when they wake up, when they go before they go to bed. And then in the middle of the day, I also ask them to record it as well. If they're having a particularly great moment, I want that information put in. If they're having a really bad day, that's when I really want that information to get put in. And then essentially we're able to collect all of that data to now predict, based on what their vitals are, when they might be experiencing an episode of pain, or when they might need to set up an appointment to come back to the office sooner. And with that said, not only am I able to monitor my patients, see what's going on, but these are billable services that have added in just 3 months with 64 patients. We're able to add an additional $30,000 of revenue into my practice, with the average amount of time that I've dedicated to each individual patient over the course of 30 days, about half an hour. So it's not a lot of, it doesn't require a lot of time, because the data is there and the data is easy to review, but you're still able to have a significant, oh goodness gracious. You're still able to get a significant amount of revenue. Now you got to think, take it back to a primary care physician, for example. You have a patient census of about 100 patients that you enroll into the program, and you want to know what their blood pressure is like. You want to know what their blood sugars are that they're experiencing. You want to know what their temperatures are. Because these patients are on, if they're a hypertensive patient, they might be on a certain level of certain type of medication. You're able to get this information, but you have 100 patients. You can make about, in terms of revenue, about $200 per month per patient. So that's about $20,000 a month in revenue into the practice, about $250,000 a year almost into the practice. But more importantly, the patients have constant supervision and constant monitoring while under your care. How it works, like I said, I had my patients put in the information daily. I like 3 times a day, but whatever the practice whatever is determined by the healthcare provider's practice would be the best information to be put in. At least 16 days of data needs to be collected in order to be able to maximize the collection. They have, through Soma Pulse, which is the wearable device that's it's awaiting FDA authorization for now. But the other devices that are used within Soma, they can put that information in and it gets into our database. You need at least 20 minutes of monitoring. Like I said, we were able to, in my own study, we were able to, over the course of 30 days, dedicate, thank you. Thank you. Dedicate about 30 minutes per patient in terms of reviewing the data, interpreting the data, and then discussing the results with the patient. And as I'd mentioned before, the economic benefit for the practice is great, but also in cost savings. That with more time, we're able to figure out how much money we'd be saving, because in the realm of primary care, prevention is key. The practitioner may be generating $200 per month per patient in revenue, but the patient's saving time and ER visits, because what happens is patients who are left alone without seeing a doctor for months at a time, the only time that they receive their primary care is in the emergency department, where oftentimes not only are the costs astronomical, but they're not in the best clinical space in terms of what therapies would be available. When you start noticing a rise in blood pressure outside, you can make alterations, say come to the office, let's alter the blood pressure. But when they come to the ER and they're in a hypertensive urgency and emergency, it's makes for a much more difficult outcome. This is just some of the codes that we would be able to put into the system based on the information that the patients, when they put that information into the system, their blood pressure, their heart rate, every day when they put that information in. Once that information is collected, the program will say, okay, they've had enough data that we can now use the 99457 code, because they've reached that 20-minute level. So the program itself is able to generate the report that we then send to the to the insurance company. And again, depending on how many, again, with the remote therapeutic monitoring, depending on how much therapy is prescribed, these are the codes, and that's pretty much what the reimbursement is. It varies, a couple of dollars here and there, depending on who the insurance carrier is, if it's Medicare, Medicaid, or a private health insurance. But on average, that's how much each of these codes would be able to generate. This is an example of the dashboard. You have your patient census. All of your patients are collecting the data and putting the information into the system. And you can customize what normal is, what you anticipate the appropriate parameters for blood pressure or heart rate or temperature. It's pretty customary. But if there's any places where you need to tweak or alter for your patients, you can customize it. And anyone who falls out of that normal range is immediately flagged, so that the patient is notified and the office is notified that, hey, this patient needs either a telehealth visit or they need to come to the office. We need to figure out what's going on once something falls out of the appropriate range. When patients, and it happens, patients aren't compliant when they're not putting that information in. If 24 hours goes by and that information isn't put in, someone from either your office or Soma Health, their database will contact the patient and say, hey, are you okay? What's going on? Why hasn't you been able to put the information in? And sometimes it's like simple as, oh, I forgot. And it's really easy in terms of how to collect the information. You just put the blood pressure cuff on and you put the device in, and it takes seconds to collect the data. So if they happen to forget it, they get notified, and that's how we can improve and make sure that our compliance rate goes to as close to 100% as possible. And the program is completely data driven. So with all the data that's collected, you can now create different subgroups depending on what you're looking at. Certain medications might work for different groups or whatever. You can individually customize what groups you want to see are responding to different treatments. So it's a really great way. Once the data is in the system, you can manipulate it and analyze it however you wish. And then again, now on the individual level, we're able to, in real time, figure out what's going on with the patient. So if this young lady, Miss Westervelt, her temperature's up. I can see it right here. It's about 101. Now, in this era this pandemic that we've been dealing with, there's a number of different reasons why someone would have an elevated temperature. So, but we wouldn't have known that if they didn't put the information in. So once that information is now put in, we can say, hey, what's going on? You set up a visit, or you get a phone call. Are you having any other symptoms that might be causing it? And again, any of these pieces of information, heart rate, pulse oximetry rate, if you start seeing someone's pulse oximetry percentage going down, you can contact them and intervene before it's too late. Just a sidebar. Well, as far as the communication, they'll either get phone calls from the Soma Health crew, the individual practitioner's office, or depending on the severity of the situation or the need of the patient, the direct healthcare provider themselves. And like I mentioned before, once the information is collected, the program sees when you're analyzing the information. The program sees when the data is getting collected, it sees when it's getting analyzed, and then it's able to develop which codes are appropriate to submit to the insurance carriers, and it can generate reports to the insurance carriers to now justify why they're paying out anywhere between, depending on how often the patients use it, up to $200 or however many dollars per patient per month. But you have the you need some type of evidence to show that what you are actually doing what you're saying you're doing, because it's easy to say that you're monitoring them when you're not, but the data has the software has the tools to send that information directly to the insurance carrier to show exactly what we're doing. And then, like I said here, with the virtual therapeutic monitoring, this patient here, this is their smartphone. Their camera on their smartphone is linked to the app, and you're able to record their ranges of motion. This is just an example of their cervical spine lateral rotation, but this can apply for any body part, and the programs it's really phenomenal the way the algorithm works. And initially you can get their baselines, and then as they go through the different therapy and different exercises that you have them do, you can monitor how well they're progressing over time. So it's really a tremendous benefit. And it works great for the patients who can't make it to the office for whatever reason. It could either be in the form of you're 150 miles away and you just can't make it, or your pain is just that severe that you can't make it to the office. There's a number of different reasons why people can't make it, but this is the way that even if you can't make it, you can still get the care that you need. That's pretty much it. I've partnered with them about 6 months now, and it's been a phenomenal experience for my patients. They really appreciate in between the office visits, knowing that they're still being cared for. And I'm not going back. As many patients as the insurance companies will allow me to enroll, I've been enrolling them, and it's been a great experience for everyone. And if anybody has any additional information, they can contact me. We can get my information from Hackford, but also Eric Morkakos is the director of Soma Health, and he's pretty hands-on, so he's also available to answer any questions that you might have. Thank you.
Doctor, that was a great presentation. What has been your experience with pre-authorization? Do you take that step before you would set your patients on this regimen?
Yes.
And
yes.
how has the response been from the payer community when you submit that you want to put this program to use?
Well, definitely. Some insurance carriers are open to it, and they've been very receptive, and others have not. But there is a prior authorization process, but the representatives at Soma Health actually help work with you and the insurance carrier to get those prior authorizations.
And do you take a geographical area for Soma Health versus other doctors that would take other geographical area, or how does that work when you say I want to be a Soma Health practitioner?
Well, my practice is in the New York, New Jersey area. And I mean, it really, what matters is your own individual census. Wherever your patients are, they can link up, to the program. It's not to say that I can only cover one area and then another. Whatever patients are within your own practice, they can have access through Soma Health.
Gotcha. Thank you. Great.
Hi. Yeah, I was just curious if Soma has any integration with electronic medical records, such as what is used in hospitals, say Epic, for example.
They're working on that.
Okay.
I have my own EMR system, and there's so many EMR systems that are out there. Epic being probably the main one, but I don't use Epic. Some of the hospitals that I work in uses Epic, but they're definitely customizing the platforms to be able to work with the various EMRs. But right now, it's completely web-based. So you can access the portal anywhere for your patients through the web.
Okay, and I have a follow-up question. One thing I find being a challenge for patients that are admitted to the hospital is that in many cases they would really benefit from receiving education. I'll use the example of, say, a stroke patient receiving education specific to stroke prevention, thereby improving their outcomes, reducing the chance of readmission. But as much as we try to provide that education in the hospital, it's not a time when they're really receptive to it, nor are their caregivers, because they're very focused on just getting home. So I see an opportunity with Soma to maybe be able to provide that follow-up education after the patient is discharged. And I was wondering if there's any kind of component like that that provides that education, as a follow-up.
Well, actually, what they do have within the representatives within the company, it's more based on prevention. The goal is to try to avoid getting to that point. So if you're seeing this patient and you're monitoring them and you're seeing their blood pressures is rising, or you're noticing the drop in their SP in their O2 saturation, you're trying to catch things early, and then when you start noticing these things, that's where the education comes in, because once you interpret the data and you now contact the patient, this is the opportunity where you're going to supplement that, not only the numbers but and the therapies, but the education. So it's kind of trying to catch it before it gets there, because once it gets there, that's when the costs get astronomical and the outcomes get tremendously less.
So when it comes to monitoring, is there any sort of automation or third-party integrations that automatically can get pulled into users' data? So for example, some of the newer iPhones or watches, they have ECG data that can automatically be pulled into the data stream. I've noticed lately a lot of diabetics have their glucose level monitors permanently attached to them that instantly uploads to their phone. Does that third-party data pull into the Soma system at all, or is it all just manual input from users at this point?
At this point, it's the manual input, and all of that information is what's going to get in, with Soma Pulse. That data, those wearable devices through Soma Pulse will now put that same information into the system. Right now, the third-party integration, it's not there yet. I'm sure it's coming, but right now it's all based on the individual devices within the company.
Thank you.
One more thing in terms of practitioner costs. For me, I'm charged $40 per patient per month. Which again, so I net about 160 per patient per month. But the beauty of Soma is they don't collect fees until after you've collected from the insurance company. So once that revenue is there, whatever the terms are, my case was $40 a month. Once I generate that revenue, that's how much I would pay. But they don't collect it until after you actually reimbursed it. And there's no upfront cost for any of the devices. That is all supplied by the company. But the only billing that they do for themselves is from $40 per month per patient after collection. All right. Well, thank you very much.
I had a question.
Oh, sure.
Can I jump in? Thank
you. Sure.
Can you give me an example of typical patient, a patient story you recall, something that shows how this technology has helped divert a negative outcome, like a hospitalization? Is there a real life story you can share?
Well, again, in my area of pain management, what I do when the patients come in and they get enrolled into the program, we see what their baseline levels are. And if they're baseline hypertensive, we send them to their primary care doctor to correct it and figure out what the cause of that might be, and correct it. If it's not coming from there, we have a pretty good estimation that their elevated blood pressure is coming from their pain. So as we continue to monitor them, and they tell us, at 6 o'clock when they wake up in the morning, their pain's at a 7, and their blood pressure's a certain level. Now, the next day, when you see that blood pressure at that other level, you're anticipating their pain to be at a certain place. So what we would do when we see those changes, we would contact the patient. We would contact the patient and say, hey, maybe it's time that we set up another visit. Maybe we need to alter. I implant spinal cord stimulators in patients, which is a great treatment that I do with patients who are in this program. When you start noticing these elevations in their heart rate and their blood pressure and these types of changes, you can call them and say, hey, is your stimulator effectively managing your pain? And when the answer is no, you can arrange for reprogramming. So on my scale, it's not as catastrophic as, let's say, preventing a stroke, because it's musculoskeletal and mobility. But there is value to adequate pain management. But I really, where I see the biggest benefit is in the primary care space, because those are the patients who need the most care. They're the ones who need the most monitoring, and they're the ones we're trying to keep out of the hospital as much as possible. My patient population, they're uncomfortable, but the outcome is just pain. Their heart is their bigger issue, their brains are their bigger issue, and their other vital organs are much more important. So in that space is where I see the biggest benefit. And we're expanding into primary care. Yeah.
So I know you had mentioned that it cut down a lot of your time as far as seeing the patients. Prior to Soma, what was the typical time frame for something like this when you were dealing with that?
Well, prior to Soma, I'd see my patients every 6 weeks, and they would tell me what their pain score is when I see them, how they were. It's hard for them to really remember day to day what was going on. When I saw them, when they got discharged from my office 3 months ago, there's a lot of things that go on in between then. So, so when I see them now, and they tell me, oh, I feel great. You can now look at the data and say, hey, what happened? What was going on about a month and a half ago? They say they're not feeling so great. But then you can look back and see in between office visits. That's where you get the real benefit, is because what's going on as best as you can, because we can't live with them, but we try to collect as much information as we can. So we know what's happening in between office visits. But up until that point, I only had what they felt when they left me the first time, and now when they're with me right now. But what happens in between there? What can get lost?
So in the 6 months you've been working with them, how compliant have the patients been as far as you?
Well, it's great, because Soma, again, if somebody doesn't put in their information within 24 hours, they're gonna get a phone call, and usually they forget, And I always, when I enroll the patients in the program, I stress the importance of doing it 3 times a day, because all I really need is 2, But if you tell them twice a day, if you get 1, you're lucky. But I tell them I want, before you go to bed, when you wake up in the morning, before you go to bed, and I really like, but it's good to have that information. If you're really bad, I want to know what your vitals are, so I can tell when things are changing, when to anticipate that you might be having an exacerbation. Like, what are you doing at this time that this is happening? So I only need 2 in order to bill at whatever code to get whatever that is, but the more data is always better.
What about patients who might live in other states? Is there a way for you to service them, or is there a barrier based on telemedicine?
As long as you're licensed in the state that you're providing the care for the patients, then you can use this program or whatever telehealth platform, as long as you're licensed in the state.
Gotcha.
Yeah.
And do you need to see them in person first, or can you just start care even if they are remote in other states?
That's a great question. That's a great question. I'm gonna have to get back to you on that one because, my practice right now is in New York and New Jersey, but I'm licensed in Arizona and North Carolina. But I haven't used Soma in the other states that I practice in yet. But I don't foresee any barrier as far as that goes. But I'd have to double check on that.
We're hoping you can leave with some Idaho patients you can help.
Yeah, absolutely. All righty. Well, thank you very much for your attention, and enjoy the rest of Treefort.